Council Liberty LeBeau.
Here.
Council Lee.
Here.
Chair Dion.
Here. Pursuant to the open meeting law, any person may make an audio or video recording of this public meeting or may transmit the meeting through any medium. Attendees are therefore advised that such recordings or transmissions are being made, whether perceived or unperceived, by those present and are deemed acknowledged and permissible. First on our agenda is citizens' input. Is there anyone here who would care to speak tonight? Seeing none. Secondly, we have minutes from February 27th, 2019.
Motion to adopt?
Second.
Motion to adopt, second. All in favor?
Aye.
Aye. Ayes have it. And the third thing on our agenda is the resolution to discuss EpiPens in the schools. And we'd like to invite our guests down to the table to have this discussion, please. Good evening. I'll first read the resolution, and then I'll have everybody introduce themselves. Whereas the Massachusetts Department of Public Health, through the Board of Registration in Pharmacy and the Drug Control Program, advises Massachusetts pharmacists and pharmacies that a prescriber may order and a pharmacy may sell stock supply of non-patient-specific epinephrine by auto-injector for use at a Massachusetts public or private school for emergency treatment of severe allergic reactions. And whereas the Board of Registration in Pharmacy and Drug Control Programs strongly support all prescriber and pharmacy efforts to provide stock epinephrine in a pre-measured auto-injector device to Massachusetts public and private schools to facilitate emergency treatment of anaphylaxis reactions. And whereas there are students enrolled in the Fall River School System who suffer from life-threatening allergies which require that they supply their own auto-injector device, commonly referred to as an EpiPen. And whereas the Fall River School Department does not provide stock epinephrine to facilitate emergency treatment, now therefore be it resolved that the Committee on Human Services, Housing, Youth, and Elder Affairs convene with the school department chief financial officer, Fall River Nursing Department Director, and the Fall River Board of Health physician to discuss this matter.
So Council, we're here tonight to discuss the matter, and the school department can speak specifically to it. But these EpiPens are included in the school department's budget and have been for a number of years. And they are part of the nursing supply at the school department. So Karen can speak specifically to what they order on an annual basis, but we do have them within the school department's nursing program.
Would anybody like to?
So we have 16.
Oh, I'm sorry, could you each introduce yourselves, please?
Karen Long, I'm the Director of Nurses for the Fall River Public Schools.
Kevin Almeida, CFO for the schools.
Steve Gagliardi, physician on the Board of Health.
Thank you.
Since 2002, the Department of Public Health set out to support the stock epinephrine program in the schools. In the beginning, we did purchase them through the school department funds, but for the past 8 years, through the EpiPen for Schools program, Mylan has provided them free for us for all our schools. We have 16 sites, and at each school, we have 2 adult and 2 junior EpiPens. We have protocols that have been written by our school physician that allows us to use them for emergency purposes for anaphylactic reactions.
How many students do we have that require EpiPens?
Right now, we have almost 250 students with known allergies. They have prescriptions from their physicians, and they bring their own EpiPens to school with them. So the stock epinephrines are for undocumented allergies to food or bee stings, or sometimes we don't know what the allergen is until they get tested. But we use them on, sometimes we've used them on students, on staff, on visitors, people that have been working out on the construction, it doesn't matter. It's if they're having an anaphylactic reaction.
Right, because EpiPens aren't allergy-specific. It's for anaphylaxis, phalanxis period, as a reaction to an
To
allergy.
allergen, right.
So how many students have to supply their own EpiPens?
Whoever, if they have an allergy that requires an EpiPen, their physician, their private physician will write the prescription. So we have about 248 right now. It varies each year, anywhere between, I would say, 250 to 280 each year.
So basically, we have 64 EpiPens that are stocked by the school department. 32 juniors, 32 adult,
Correct,
essentially.
yes.
And then we
I
have,
think then there's the
They double.
248 on top of that.
Right,
and then we have 250 students who have to supply their own on top of that.
correct.
How many EpiPens, I guess would be school by school, in reality, how many EpiPens do you think are necessary to accommodate 250 students? Because I'm thinking, and again, I don't know, so I'm asking, 314 EpiPens seems like an excessive amount, that we wouldn't need that many to be able to take care of the needs of our students?
Well, each student requires it to come to school because they have to have it on them, like when their parent picks them up from school, they have to have their EpiPen. When they fill a prescription, they get one for home and one for school. If they go on a field trip, they have to take it with them. They can't leave it in the school, it's got to go with them. So each individual child has it for a different reason, has a different dosage. Sometimes it's just one EpiPen, sometimes it's two, depending if the physician writes to repeat the order. So I would say that what we have for stock for undocumented allergies it's two different things. It's emergencies and then a student that needs to have it with them all the time. So you can't just have, say, 5 in a school to cover 26 kids that have an allergy.
Counselor LeBeau?
It's on. Thank you. So the students that have it, that have one with their prescription, does that stay in the nurse's office for the year? Or does it stay on them?
It depends, it depends. The little ones, it stays in the nurse's office. We have some at the high school that are old enough to carry it on them, plus the high school is so spread out, and the nurse's office is at one side of the building. But for the most part, it's in the nurse's office. Sometimes, depending if we have two, and sometimes one is kept in the classroom and one in the nurse's office. And then if there's an emergency, it's right there, because we are able to train non-licensed personnel. We are certified, licensed from the Department of Public Health to do that every year. We have a training program for teachers, paras, so we do that too.
I'm just wondering, so I think, correct me if I'm wrong, the point of this is so that the families don't have to have the expense of having one sit at the school. So my daughter has a emergency epilepsy medicine that costs a lot of money. We have to get two, one for the house and one for the school. That's something that is very specific. It's dialed in by her weight and all of those things. And it goes with her on field trips and it stays in the nurse's office. And I get it. At the end of each year, if it gets returned, if they don't use it. But while you want it there for emergencies, for some families, they might not be able to afford the emergency of this. So I think that Councilor Dion was seeing if there was a way, if there was a set number that you could have to cover, especially maybe not the high school kids, but the smaller kids where it is left in the nurse's office, so that they didn't have to each buy an additional one just to be left at school, and not have to put that money out.
I think for the low-income student, I mean, if they're on Medicaid, it covers it with no deductible,
Yeah, Mass Health.
Mass
Most
Health.
of our students are on Mass Health.
covers it. So there's no cost to the family. You're right, when you get up and, parents have more income and you have private insurance, then you're responsible for your co-pays, your deductibles, just like anything else. But when you're talking low income, covered by Medicaid, if they're on Mass Health, like any other medication, there's no expense.
Okay. I yield.
Counselor Lee?
I have nothing.
So, how many children do you feel fall in that midsection? The ones where the parents do have to pay out of pocket, where some of them are, we have 70% of, the superintendent recently said 70% of our students are live in poverty. We have people that are just barely above that. And, having to purchase 2 or 3 EpiPens every year is a burden, is difficult. I mean, is there anything we can do to help those people?
I think, it'd be hard to, if they're on Medicaid, if they're on Mass Health, they're all set. So you'd have to, then you'd have to go through each family's insurance, what their deductibles are, somehow figure out, is that too much, is that too little? If a family is on Blue Cross, it depends on their plan what their actual cost is. So if you're talking these lower incomes, and if people are at the poverty or below poverty, I'm pretty sure that the kids are being covered by Mass Health. So for those people that you're talking about, there wouldn't be any cost. And this is something that's part of these kids' daily lives. It's just not, just like your daughter, when she leaves school, this whole thing follows her. So just like anywhere they go, they have their EpiPens. So the prescription, if they get a prescription for 2, and that's covered, then they have their 2. So 1 for school, 1 for home, and then when they expire, they get the prescription renewed. I think it would be, if someone really wanted to, you'd have to do a whole financial thing to see what everybody's deductible is. It sounds like we do have extras at each school, and it sounds like everybody who needs one has one.
Yeah, they don't come, if they require it from their physician, they don't come unless they have it all in place. And the nurses take care of that the first week of school. They get their orders from the doctor and the parent and the medication.
Counselor Lee?
Yeah, just a question for my own curiosity. How frequently, the 64 that are used miscellaneously, what we'd say.
Right.
How frequently are they used?
So this year, we've used 4
Okay.
so far this year.
Is that usually,
Yeah, you used, yeah.
so you're not in any kind of crisis of supply or anything?
No.
Okay.
Not at this point, not for the stock EPIs, no.
Okay,
Not
yeah.
at all. Because once we use them, the ones we use, this program allows me to send in a report, and they replenish the one we use, so they do send it back. So we're always getting it back to
Okay,
what we ordered.
thank you.
So have you ever used all 64 in a school year?
No.
Okay, so I
But
guess.
they're in different schools. There's only,
Right, I understand. So I guess that kind of brings me back to, I feel like perhaps there would be something we can do to help people. Because if you're not using all 64, and we have 250 being brought in, and the majority of those at the end of the year are being thrown away because they're not being used either,
I think almost all EpiPens get thrown away at the end of the year.
yeah.
Because the whole idea isn't just to have an EpiPen and, run amok. These families are well educated on what they're supposed to do. This is a part of a whole program where, you know what the allergies are, and I'm sure
what the weight of the
using-
child is. because
the
that
nurses are
changes
gonna
too.
say, okay, this is a whole program, we're gonna limit the risk, there's all programs about peanut allergies, everybody, there's programs about everything. So, part of it is educating the people in the area about what to do and what not to do. EpiPen is, a last resort. And I think a lot of these stock EpiPens are for unforeseen circumstances. Like if you're at a Durfee, a gym, and you're out in the fields, there's woods out there, a bee comes and stings somebody. That's what, the extra ones are for. All the kids who have peanut allergies know not to eat peanuts. So that would be an unforeseen situation where they come in contact with it, and then, their EpiPen is at the nurse's station.
One of the things that prompted the stock EPIs too was the studies that had shown that most students, children, their first allergic reaction was occurring at school. So DPH kind of hopped on that and said, you know, we want to get stuck EPIs in the schools. And the EpiPens now, also, Pfizer has extended the expiration date on a lot of them for another 3 to 4 months. So now they're lasting a little bit longer, that, you know, we get them 1 year, and some parents also leave them at school so that they're there in September, they're still good for a couple more months, and then they get the new ones.
Counselor LeBeau?
So I know that the school nurse calls at the end of every year, and they say that we can either pick up HERMED or they'll dispose of it. So the parents, they don't do that with those? They allow them to keep it at the school?
Sometimes they do, because sometimes they're there during the summer programs,
Okay, that makes sense.
so we have to have them.
So then if Mass Health takes care of any of the financially at-risk families that might not be able to afford it, then the only ones that we would be worried about are those, did you say at the beginning of the school year, if they don't have it in, then they can't come? So that would be, I think, where we would notice if somebody possibly couldn't afford it.
Sometimes that's the case, but sometimes it's not the case. Sometimes it's just they haven't gotten to the physician, or they just haven't gotten to go get it.
Okay. Okay, I yield.
I think if, there was a hardship and you could identify that on an individual basis, just let it be known. If there is a hardship with copay or anything else that, then we could jump in and help out. I mean, it wouldn't be a huge expense, especially, we do have the free ones. And those
They
could
wouldn't
be.
be, well, the free ones that we can get are only for stock, they're not for individual
Yeah, 'cause
students.
they-
We can't get them for
Yeah, you need a
individual students.
prescription
You'd have to pay
per
for it.
person. Those free ones are a prescription to the school system. So it's a little technical
That
difference
state
there.
pharmacy that you mentioned, and it's just for schools, it's not for individuals.
So it's a prescription to the school department that can be used on anyone in the case of an emergency,
Correct.
however. So
Correct.
even though they're not specific to an individual, they can still be used on any individual within the confines of the school in an emergency
But they
situation.
But a
will
student
only
with
give
an-
me two. They
Yeah,
will
but a
only
student with a known
give me one.
allergy can't come to school without an EpiPen. So,
Just
They have to
like,
have
just
that.
like a child that has seizures, that has their diastapha, they can't come. Just like a diabetic can't come, if they're on insulin, they can't come without their equipment and their insulin and their glucagon, which is an emergency medication for diabetes. They have to supply all that.
but now you're talking about an issue where, someone has private insurance, but their copay is too high for this medication. So where do you draw the line with other medications? Now you're gonna start helping, well, my copay is too high for this medication. Once you create that precedent, now someone else is gonna say, well, my kid can't afford his medication, you have to pay for it because he's in school. I think you gotta be careful with that. Because then you're gonna be on the hook for, and then what's too high of a copay? Who's gonna determine that? I think, Mass Health covers people who need to be covered by Mass Health. The kids who need it
Which is really
get
the
Mass
purpose
Health.
of Mass Health, right?
And that's what it's for, so they're covered.
And they have different levels in Mass Health. According to your income, what the copay is, they set it, they set the rate, so.
And then people have private insurance, they have private insurance for a reason, and they know what their copays are. And so that, it's like any other medication.
I understand what you're saying. Not all meds, however, are one-time emergency life or death dosages either. So it is a little bit different, wouldn't you say?
I don't know what the copay is. You have so many different insurance plans and so many different copays based on premium. You'd have a tough time picking out, you got two different people with different insurances, their copays are gonna be different, but they chose that insurance and they chose the copay, so it's gonna be hard, And then who's gonna say that copay is too high or too low, and how we're gonna help with that? I think the programs are in place for the low-income families. So the ones you're talking about, the low-income people, are gonna be covered by Mass Health, so their medications are covered.
It's always the people in the middle that seem to fall through the cracks and get hurt.
Has there been people who haven't been able to get their prescription?
No, we haven't. They usually get it.
I think something this serious usually gets taken care of.
The only time we had a problem
Pretty
getting
well.
it was there was a period of time where there was a shortage. And what we did was, worked with the families, and I called different pharmacies, because if you try different pharmacies, sometimes you get one that, oh, I have one in stock. So we sent the parent to that pharmacy. So that was the only time we had a little bit of difficulty.
Yeah, and that was a nationwide shortage of
Yeah.
epinephrine that was happening in, offices unrelated to EpiPens.
Right. But we did work with the families to get them.
Would you like to, anything to help offer to us?
I'm just the money guy. I agree with this gentleman's assessment. I just don't know where you draw the line with something like this. If it was a situation where it wasn't, student-specific, and it was just like a general kind of like EpiPen that we would have to purchase to help satisfy, a situation, I think we would support, the situation, but I guess I don't know where you draw the line, I guess.
I think if there's an individual who, has a hardship, for some reason isn't on Mass Health and can't afford the copay, then I think you take that up, on an individual basis. I don't think you're gonna be able to make a general ruling about this.
Right.
And then, try to figure out a way to pay for that one person, which wouldn't be a lot.
No. And I will say this, the school department's here to support as much as we can. If, on these one-off kind of situations, if they happen, I'm sure we could come to some sort of resolution to help out a family if we had to.
I mean, we know all the people with the allergies, so,
There are known allergies.
you
Right.
know, and they're bringing in their EpiPen, if anybody, I guess you could let them know if at any time you have difficulty
We
paying.
haven't had anybody come to us and say, I can't do that, I can't
Yeah.
afford it. I mean, if that's the case, if they did say that to us, then, I'm sure we could help.
That was my question. I was going to ask you to have people come forward with that request.
We have, they usually, sometimes it takes a little time and a coaxing, and, you gotta go to the doctor, you gotta get it, We start in June, the year before, May and June, sending notices out so they can get their orders over the summer, and,
Yeah, because I'm
seems
sure it
to
gets
work
busy
out.
at the pediatrician's offices right before school, because
Yeah.
everybody needs a physical, right?
yeah,
And
but
they
it does get
You wait
busy.
too late to make your
Orders-
appointment and you're out of luck.
Orders get busy.
And I think sometimes people do put it off because it is a struggle. And, obviously, they know they have to do it, and it's a life-saving measure for their child, so they're not gonna let their child die and I think that's why sometimes they aren't expedient in getting them either, because it is a process to be able to afford to get them sometimes. So I don't know if there's some avenue
I
that
don't know
we
if there's
could
really- I mean,
take.
Is there an issue that anyone's come forward and said they couldn't afford it? I'm hearing that.
And if there's any student or any family that doesn't have insurance, please send them to me, because we hook them up with a couple of different centers that we work with, community agencies that help sign them up for Mass Health, because every child in Massachusetts is afforded insurance, healthcare.
Yeah.
So if you
So
know
if
of anybody, just,
If everybody gets Mass Health, then everybody gets prescriptions and everybody gets their EpiPen.
Yeah, and I'm sure, as Mr. Almeida indicated, if there were an individual that came to school or a parent that came to school and said, I can't afford this and I'm not on Mass Health, I'm sure the school department would assist in either providing them with the information to get them on Mass Health or assist them in some other way. But based on what I'm hearing from the school department, we don't have any situations where we have children or families that are not able to afford the medication for their students or their children.
So if there is a situation where somebody is struggling, they have an avenue, they could contact, who would they contact?
well, they probably would, first point of contact would probably be their school nurse, because she would be the one that's asking for the prescription, for the doctor's order. And if she becomes aware of it, then she can just contact me, and then we'll talk together.
Counselor LeBeau?
I just have one final question. Is this the only medicine that is allowed to stock supply at the school?
Oh, I have Narcan,
Narcan?
which the school department pays for, through the same type of pharmacy. And that's probably the only
That's it.
two things that, yeah.
Oh. I yield.
Which I think that's where my struggle is, because it's a life-saving measure, and we have other life-saving measures in schools, so I think that's just where my struggle comes from. But I appreciate you all coming this evening. Hopefully, if there's anybody out there struggling, now they know at least they know they have an avenue. And, any more questions, any comments? Thank you again.
Thank you.
Thank you.
What would you like to do with this, Councilman?
I would entertain any emotion or thoughts that either
Would you
one
like
of you
to
might have.
table it, or you want to table it? I don't know that you seem fully done with it.
I would entertain a motion to table it.
I have, I need that, but maybe if there's some type of public announcement that can be made, or PSA or anything like that, where if there is any concern, if there is a population of people who are concerned about affordability for the pen, that they have the point of contact, out there on the website, or on the Fall River
That's a
website,
good
maybe
idea.
the Fall River Education website.
To let them know.
Yeah, to let them know if there are any concerns for it. I think that could resolve the issue based on the information that we were gathered. So,
Motion to table.
second.
All in favor?
Aye.
Aye, ayes have it. I'd entertain a motion to
Motion to
Motion to
adjourn.
adjourn.
Second?
All in favor?
Aye.